transparent health, keeping patients safe. Disclosure. This short film will provide you with suggestions about ways to obtain information about you or your loved one after harm has occurred during medical care. You are entitled to an honest and understandable explanation of the facts surrounding any unexpected adverse event.
When we got home, we were expecting a phone call. We thought that this was an earth-shaking event and that the hospital would be in consternation and that they would be conducting investigations immediately and that they would call us up and, interview us, want to know what had gone wrong. They had to interview us. We were the only people who were there. The only surviving people who were there all the time. I was the only person who knew everything that had happened to Lewis. A few weeks later, they sent us some literature in the mail on how to cope with grieving. But that was it. And we never heard from the surgeon about the autopsy.
For generations in healthcare, there's been a sort of duck and cover. There's been this wall of silence that's been put up, where patients and families were never told what happened and why. And the good news is, in the recent years, more and more patients or families are saying that we want to be told the truth. We don't want to be abandoned. And the other good news is that there's more and more cases of physicians, nurses, and hospital executives and others, and even lawyers and risk managers who are realizing that, yes, we haven't done it right in the past, that we need to tell the truth to patients and families when there is a bad outcome. It's much, much easier for patients and families when they are told the truth. The worst thing that we've done in healthcare over the years is, to be honest, we've been lying to patients. We've been not telling them the truth. And that creates such a burden for them, particularly in cases such as Lewis's. Family members can feel as if they are part of the problem, that it was their fault. That's a terrible burden that we put on them. That should never be.
The disclosures that occur go beyond just, me to you or me to the patient and family. It's our institution to other institutions and to the medical community as a whole for people to understand these are the kinds of things, just like in Lewis's case, these are the kinds of things that can happen in any hospital.
I think one of the most important points that we could take around these types of cases is, while they're very unfortunate and we need to learn from them, it's also very important that we do the correct thing after the fact. What do we do defines who we are as providers, and professional caregivers really helps promote healing. It helps bring closure, and it's an important part of healthcare that's been lacking for many years.
And finally, a month later, we called down there. He really didn't understand, the sequence of things, what had happened. So we told him what had happened, and he appeared to be shocked and disturbed, and he said, "Do you blame yourself?" And we said, "Oh, every day, every minute. You feel guilty for every breath you take if your child has died." And he said, "Don't blame yourselves. This is our fault. This is our responsibility." And at one point he started to cry, which to us made us feel better that he cared.
If we don't talk about our mistakes, we're doomed to repeat them over and over and over again. So we have to have transparency and admit that we made a mistake in order to know what to do to try and prevent that mistake from happening again. And if we don't do that, shame upon us.
If you have any questions or are unclear about any of the events surrounding harm associated with medical care, you should ask your doctor for a clear and understandable explanation. Understand that all hospital and health systems are required to have a process in place to provide an honest explanation of the facts related to an adverse event resulting from the actions of their caregivers. Know that all hospitals and health systems must have a health information management system or medical records department that should contain all of your medical information, including doctors' and nurses' notes, medication orders, and laboratory test results. You have a right to a copy of that information. In the event you are unable to obtain an understandable explanation of an adverse event, you should request to speak to the hospital's patient safety officer, chief medical officer, or someone in the Department of Risk Management to ask for assistance. The Joint Commission and the Centers for Medicare and Medicaid Services, CMS, are organizations that hold hospitals accountable for providing explanations after harm occurs, and they should be contacted if you are unhappy with the explanations you have received. Transparent Health, keeping patients safe.